Black cohosh grows wild in shady wooded areas in eastern North America and parts of Canada. It's a member of the buttercup family, and it's also known as black snakeroot and bugbane. The roots and the rhizomes contain several substances that may be beneficial for health, including phytoestrogens, sugar compounds called glycosides, and isofrulic acid, which have anti-inflammatory effects. It's been used by indigenous tribes, settlers, and more recently as a supplement. One characteristic that makes the black cohosh a unique and sought-after plant are the phytoestrogens. These, as the name suggests, reproduce the effects in the body similar to that of estrogen. For health, they can be useful to alleviate some of the effects brought on by the menopause or PMS, such as hot flushes. This is one particular effect of the plant that will be explored here. Black cohosh has an effect on the brain. Its phytoestrogenic properties mean that it works on the receptors in the brain that transmit serotonin, the happiness chemical. Serotonin can help with pain relief, sleep, and mood swings, so anything that can help its reception in the brain will have a knock-on effect in these areas. During the menopause, the balance of estrogen and progesterone becomes unbalanced. It's thought that the aforementioned phytoestrogenic chemicals within the black cohosh bind to the estrogen receptor and increase its activity. This helps to balance the hormones and relieve the uncomfortable symptoms like hot flushes, irritability, mood swings, and sleep disturbances. The black cohosh has been well studied for its effect on menopausal symptoms, but the findings are somewhat contradictory. Several studies have shown great improvement, while for others the benefit has been modest. This might mean that you have to take black cohosh for longer than most supplements to experience the benefit. In one large-scale study, 704 menopausal women took the black cohosh over a 4-week period. 87% of the participants experienced improved physical and psychological symptoms. Of these, 49% experienced a complete relief of their symptoms, while 38% reported significant improvements. In a separate study, menopausal women who took the black cohosh over a 12-week period found the average number of hot flashes fell from 5 per day to less than 1. There's many who believe the black cohosh has little effect on the menopausal symptoms, apart from its effect on the hot flushes. A 2008 study found it had no effect on things like the vaginal epithelium, the tissue found outside the vagina, or the endometrium, the uterine lining, both of which can cause issues during the menopause. One reason for the varying results might be that many studies don't note the kind of preparation that was used. This can make repeating the results or finding the correlations more difficult. It also means it's more difficult to garner the quality of the supplement used in the trials. In the past, black cohosh was used to treat inflammation, along with its myriad of other uses. There's some scientific evidence to show that it can be effective in this area. A study from the University of Hong Kong has identified a compound in black cohosh and similar species that plays a role in its anti-inflammatory action. It's because of this the black cohosh is often combined with other anti-inflammatory herbs like willow bark, sarsaparilla, to treat inflammation and associated arthritis and osteoarthritis symptoms. It's been discovered that it has antioxidant effects. It protects the cells against damage done on a molecular level. This is important as the oxidative stress this damage can cause affects the delicate parts of the body, such as the brain, even leading to certain cancers and strokes in serious cases. A 2002 study showed the black cohosh can protect against cellular DNA damage that's associated with oxidative stress. Incredibly, one antioxidative compound in the black cohosh was also found to inhibit the growth of certain breast cancer cells. As mentioned previously, black cohosh can assist with serotonin receptors. One piece of research from the Journal of Agriculture and Food Chemistry suggests it may be the source of its influence on the hot flushes. Ultimately, the link between serotonin and hot flushes requires more research. One study gave participants with hot flushes a selective serotonin reuptake inhibitor, which increases the amount of serotonin in the brain. They found those using the SSRI had a higher satisfaction rate with the drug in fighting their hot flushes compared to a placebo. This means there is a link between the black cohosh and its increased serotonin uptake and its positive effect on the menopausal symptoms. The black cohosh can be taken in several different forms, most commonly as a tea, supplement, or tincture. For the treatment of menopausal symptoms, it appears to be effective in daily doses between 20 to 80 milligrams, and it often takes a minimum of at least 2 weeks for the benefits to be noticed. The North American Menopause Society also recommends lifestyle changes alongside the use of the black cohosh supplement for the relief of the menopausal symptoms. Black cohosh can be used to induce labour, so it shouldn't be used during pregnancy. It should also be avoided during lactation due to the insufficient safety data. It's not clear whether the black cohosh is safe for women with hormone-sensitive conditions like endometriosis, fibroids, breast cancer, or ovarian cancer. Therefore, it should be avoided by these patients. Black cohosh has a low incidence of adverse reactions and it's considered safe when taken in the recommended doses. However, for some, it can cause mild side effects, including stomach upset, cramping, headaches, rash, or vaginal spotting. If any of these side effects persist or worsen, you should discontinue use and consult a doctor. Experts are unsure about the long-term side effects of black cohosh. Some think it may cause liver damage if taken for an extended period of time. It should not be used for more than 6 months. Ensure that you are sticking to the directions given on the package and not taking more than recommended. If you experience any conditions like jaundice, which is yellowing of the skin or the eyes turning yellow, darker urine than usual, or chronic fatigue, then cease taking the supplement and consult a doctor. The black cohosh contains salicylates, so it should be avoided by people who are allergic to aspirin. It might also interact with certain prescription medications. With all the research that's been conducted on the plant, black cohosh has proven to be beneficial to human health, while still retaining some mystery. Nonetheless, for those who are looking for a gentle way to tackle the menopause symptoms, its phytoestrogenic effects may provide relief, especially from the uncomfortable hot flashes. To learn more about herbs, supplements, and natural treatment plans, check out my website.